As the coronavirus pandemic spreads across Black America, African Americans are getting hit the hardest.
Very well under control in our country. You have very few people with it. The people are getting better.
Hello, I'm Eric Williams. Today I have former Dallas County Health and Human Services Director, Zach Thomas, who's going to be joining us, sharing with the community and the nation at large what's going on and what's happening here in Dallas County as it relates to the coronavirus. Mr. Thomas is well-versed. He's handled Ebola across Dallas and the nation. And I'm excited about having him here today.
Thank you, Eric, for getting the message out. A lot of information relating to the coronavirus is not getting out, so especially to African Americans. So thank you.
Now, there's been rumors that the virus has peaked in Dallas because of reports that it's slowed. As the former county health director, what is your take on it, and what have you heard, and what are you seeing in the county thus far?
Well, let's look nationwide. You know, we hear it from different states and counties about peaking, but I want to clarify, that's just a term in terms of we have peaked. There is no vaccine for this virus, for the coronavirus. So when you see a peak, they're talking about in terms of hospitalizations, the number of people who may be hospitalized. That's one of the issues that they're clearly focused on. But in the community, you're still seeing the transmission of the virus. So I don't want us to, in terms of just wording, they're saying we're trying to peak, but I want us to use our minds and ask ourselves, how can you peak when there is no vaccine and the virus is still circulating? So let me give you an example. Okay. You clearly have the number of cases that you have, well over 2,000 cases in Dallas County, and it's growing. They just came out with new numbers today. Correct. And so one of the things you have to look at is that in terms of this specific virus, which is a respiratory virus, which is a new virus, when you see the CDC doing their model, that's a model based on the data, but there's two issues that we have to run parallel. That's the data they have on confirmed cases, but 80% or the majority of the people will be asymptomatic, which means they will not have symptoms. So I don't want us as African Americans to listen to that we peaked and we're relaxed because the virus is still circulating. Give me an example. There's no cure for the common cold, correct?
Correct.
That's a virus. You have flu virus every year. We can even take the flu vaccine and still get the flu, but it won't be as severe to us, the mere fact that we've taken the vaccine. Now, I just said common cold,
yes,
flu.
Mm-hmm.
Now you have COVID-19 and there is no vaccine. So how do you peak?
Yeah, that's a great question because, you know, like you said earlier, the numbers came out today and the coronavirus, I think they're saying is 200,000 worldwide that have died. Right. How are those numbers impacting Dallas County and Black America, since we are talking about the peak?
Well, it's impacting African Americans because throughout the nation, as well as locally, when you factor in African Americans and Hispanics, we have the highest number of deaths associated with COVID-19. When you look at the numbers that they're putting out there are people who, as you will see in New York and here recently here in Dallas County, where they found an individual dead in their home. And so what you're up against is there has to be a public health strategy where you're actually going into communities and working with high-risk areas. I volunteer in South Dallas. Every week I'm there, and throughout the week I'm over in South Dallas. one of the things that we see early on is not enough people in South Dallas wearing masks. But there was a confusion. And I want to show you the parallel, and I want to make sure I'm kind of tracking this, that we stay on task. Early on, they said don't wear masks because they wasn't effective. As you saw more community transmissions, now they're saying wear the mask to protect you and to protect me. Because here's the key. They're not clear on the transmission. They know that it goes in the nose and to the mouth. That's why they want you to wear the face mask. But in terms of surfaces, what you're touching, most people don't know what they did before they were transmitted with the virus. So I'm going back to the numbers. I don't want us to get caught up in seeing a peak, because if we stay in our homes for the next 6 months, whenever we come out, guess what? We're gonna still have to deal with it. There's still no vaccine. So as soon as we start circulating again, what's still out here? The virus. Right. So when they say peak, they have a number they're looking at. Number of hospitalizations have gone down. Number of cases that they don't see per day. They're looking at a model. But if you pay close attention, they back off those models a lot of times. You don't see those models roll out like you did early on because they're getting challenged. There's a hypothetical model in terms of this is what this will look like if we don't shelter at home. There will be millions of people that will die or have to be hospitalized. Now they're saying the model, because we're sheltering home, that's helping to reduce the transmission. I want to be very clear. The transmission or the virus is still going to be there as we go back into the communities.
Well, your successor, Dr. Philip Hong, I believe it is, says that staying at home and wearing masks will make a big difference in bringing down those cases. And that sounds like what you have just alluded to just now. And everyone really needs to take heed of the message of wearing these masks and staying at home. But, you know, Dallas County wants to reopen. The governor is kind of like leaving it up to the county judges, but at the same time, he is declaring that it's his authority to determine whether or not each and every county should open up. So what's your take on that? And are we hearing this correctly?
Well, I think you're going to hear different models. The model is you're going to hear the public health model, and then there is the economic model.
Okay.
So that's where the two are connecting. What Dallas County, Tarrant County, Collin County, I put everybody in the same boat, all counties throughout the United States. They're dealing with the same scenario.
Right.
And but if you look at from day one, when they first start talking about the coronavirus, you've seen various changes each week. The more they talk, the more changes. And the one example I gave was wearing face masks were not effective. Now we need to wear them. So back to your point. I'm going to say, let me throw out this example, and then I'm going to come back and talk about the two.
Okay.
For everyone who don't want to open up because they fear, then don't take a paycheck and put yourself and donate your money to the individual who is not working.
Correct.
Okay.
That includes the senators, the Congress leaders, the governors,
right?
The mayors, everybody.
Right. Don't take a check.
Don't take a check.
Donate your money to those individuals who are at home, who have lost their job, who have been furloughed, who can't pay their mortgage and can't buy their food, because you've seen the people in the food lines. So what I want to make sure is clear, it depends on what perspective you're in. If you're drawing a check, you'll say, okay, well, we need to sit at home on a job that doesn't allow me to take off without, with pay, and I take off, without pay,
right,
then I'm suffering the consequences. So let's go back to the two models. We're going on a 1918 model, which was
Spanish flu, right?
Yeah, Spanish flu. Okay, so I want to be clear. You have an astute audience. I can only imagine if they went back and looked at how many people in 1918 were in urban cities, and let's say specifically Dallas, Texas, or Dallas County.
Mm.
Okay, so that model is clearly a workable model.
Got it.
Because most people were in rural communities. Of course, on the East Coast, you might have had more people, but I'll let everybody kind of take a look at that. Now, fast forward to 2020, when you got 2.3, 2.4 million people in Dallas County, Harris County, 3 to 4 million people.
Mm.
We've been looking at pandemic planning since 1999. Before that, they were looking at nuclear attacks, how we're going to deal with biological agents. In 1999, they put together the Strategic National Stockpile to begin to look at how we're going to have N95 masks. Because I want to make sure your audience know this ain't nothing new.
This ain't nothing.
In 1999, N95 masks, ventilators, equipments, anything that you're going to need to stand up during a pandemic. The key point in this is that simultaneously, that's where you got the difference. When you plan for a pandemic or a disaster, you may think only Texas will get hit. So you got the other states that can support it.
Powerful.
Well, I want to make sure it's clear.
Yeah.
The planning, so it's like your family or my family. You take care of your household, I take care of mine. You got brothers and sisters, they don't have a job, they start depending on you. Let's say all your sisters and brothers and everybody don't have a job at the same time. You know what you're gonna say? Hey, I can barely take care of my family. Now I gotta try to help my brothers and sisters and other people. That's what you're dealing with when you have a pandemic that hits all 50 states at the same time. And that's where the difference is in terms of this particular virus hitting America at the same time. And so when people say, well, we're out of N95 masks. Okay, I'm confused because N95 masks is the gold standard. And so every state should have an SNS, a Strategic National Stockpile, in place to deal with their Pacific residents. And that's part of the planning. So I want to make sure your audience knows that, they can, we can get on the current president, we can get on anybody else. I want to be clear. 1999, they started talking about a pandemic and planning for a potential biological or some type of pandemic that could hit the United States. I don't think anybody thought it was going to hit at one time. And that's where everybody is caught off guard. So going back to should you open or should you not open? Okay, I leave that up to, the current health commissioners and those involved. But I do have to run that dilemma. If your job is not paying you while you're off, furloughed, and you're about to lose your house, you're about to lose everything that you have worked for, then we have to listen to those individuals.
Yes.
And so let me throw this point out, because again, we all went to school. If you don't have a vaccine and we stay in, here's the question: how long do we stay in?
That's a great question.
The virus is still circulating. So everybody's saying, well, in the Black community, well, we shouldn't come back out because it's a serious matter. Well, I'm gonna say something to that effect. I find it amazing that they find us to talk about the impact on the church, the impact on other things, but they don't call you to ask you, do you have an African-American physician or nurse in your congregation that can be on the planning to talk about the impact? So I'm trying to understand, why are we buying in to the fact that this is going to be the worst economy since the Great Depression? We have a virus that you don't have a vaccine for, and we're not even in the discussion. The only discussion we're getting is what we see on TV. We sit in those meetings from 1999 to I retire. Here was the key point. No one wants to execute shelter in home, and that's why you didn't see it mandatory, because law enforcement knows that would be a difficult task to lock down
a real quarantine.
A real quarantine. So now if it only happened in one area of Dallas, I don't think they would have a problem with it. But now you got to lock down the United States. And no one is prepared for that. I went long on it because I want to make sure that you got an economic discussion, you got a public health discussion. The one on the economics, I'm not getting a paycheck.
Mm.
On the public health discussion, they say, well, there's no vaccine, but then nobody's doing the testing. And I've been hearing that. I want to make sure I clear this up on the testing.
Do you think that we need more testing in Dallas County? Because as of today, I do believe we got a site over at the field house and another one in Tarrant County. I think we got 2 testing sites.
The testing, there is not enough test kits for everyone. You know, you got a testing site now, I think over in Walgreens. Let me be real clear. The testing sites should have included not only drive up, but walk up facility. And again, my point, when you have no African Americans or Hispanics in the discussion about what impacts the community, because we had that when Ebola hit, Dr. Perkins and myself, we went down because one of the nurses lived over in the M Street area. We walked that area. We provided education. That's where you have to take it to the street. But I'm going back to this scenario. Somebody said, well, you know, that's do drive up testing. Well,
not everybody drives.
Well, not everybody drives. Here's the best example I can give. In all of our ISDs, I never want to call a Pacific one because most of them do this. All of our ISDs now provide lunch to the kids while they're out, right? And you seeing people drive in their own cars or the buses to the neighborhoods because the kids don't have no cars.
Powerful.
Okay, why would you have drive up testing only?
Only.
I mean, because that's the discussion. Because if majority of people are asymptomatic, so they're going to say, well, you know, Zach, we wanted to get those who were sick or those who had the symptoms. Well, I want to point out to you that the symptoms, the majority of them are asymptomatic, so they're not going to have a symptom. So that's why you're going to have community spread. So when they say more testing, for us, I want to be clear. There's not enough testing to go on.
Clearly not enough.
They should have done, and they should have done the testing early on. That's you know,
that's a failure, though, I believe.
Well, and it's a smoke screen to slow up, because when you go to the doctor, I go to the doctor. I go in, I say, yeah, I got a headache, my nose is running. That's what the doctor said. What brought you here today? How many times we go to the doctor and we say, I just came in here to see you. I ain't nothing wrong with me. He said, well, I'm about to run some lab tests on you. You know, I'm feeling tired, but I don't have any symptoms. Okay, that's what we're dealing with the coronavirus. Most of them are asymptomatic. You could be around a person who is a super spreader who is spreading the virus, but shows no symptoms.
Shows no symptoms. So can that person that's asymptomatic that had it or could have been tested positive, can they catch it again? Because there's a lot of myths out here that's saying that, you know, once you got it, you're immune to it, you can't catch it again.
According to the scientists, they're saying that's not the case. That's the World Health Organization. They're saying that that's not so. You can catch it again. I saw people on Twitter saying that Black people couldn't get the coronavirus. That was all a myth. So we got a lot of information out here that we're really not dealing with, but I don't see us as decision makers. We're in 2020 and we're not even in the discussion. Here's the amazing thing. Only when they say the number of people who are dying is African American. So then they're bringing an African American. Well, what do you think about it? Well, I think there should be more testing. Well, let me go back to they're saying in their timeline that all of this started around January, the discussion. Okay, so where were the African American and Hispanic in that discussion in January? Then we go through February, then we go to March, and then we wake up one day and they say, we're gonna lock everybody down, shelter in place. Give me a break.
Yes.
That's not how you do the planning. And I was in what hit me the most is when they came up with this, where everybody needs to wear a mask. And I was in CVS one day, I heard a senior citizen say, I'm looking for a mask. And she don't know where to get a mask, and they didn't have any in there. And I say, how disconnected are we to be talking about getting masks, and low income and African Americans and Hispanics who don't have access to masks? No one provided free masks to these individuals. No one is going into those neighborhoods. I see people standing in line at stores in South Dallas, Oak Cliff. They talk about DeSoto as having the highest number of cases. Okay, so, but what is that? Is that the nursing homes? One of the things we point out is that the homeless shelter, they had an outbreak. And I'm saying outbreak, but they had a number, at least 40 cases. And if you go to the website, everything I'm talking about is based on whether you're looking at Dallas County, Harris County, all of them have their surveillance data. And you can go down and you drill down and you can see that there are cases in the homeless shelter. And they have a Health and Human Services staff who have to shelter in home because they came in contact with these specific individuals who were confirmed positive. So what my point is that the issue is, where are we in the discussion? And oh my God, we're talking about the church. I'm for the church.
Right.
Don't have a conversation with African Americans only about the church.
Only about the church.
With every congregation in Dallas, African American, Dallas County, there are nurses, doctors, professionals that could be in the discussion, that could have been in the discussion, but the only time you come to us is when it's time to pray or time to talk about the impact on the Black church. Come on.
Well, that's a great segue, and that's a great point, because one of the things that you mentioned was the fact that, the numbers, the data. But with the data, I'm seeing that there's not a release nationwide of the collection and the dissemination of racial data as it relates to the coronavirus. I think that we should have that data collected through the CDC or the NIH or someone, but you did mention something about the website. Let's talk a little bit about that racial disparity in the data that we're not really seeing, but they're saying that Black folks are being impacted disproportionately. But
when you look at the data is going to show it in the deaths. So when you go to the data, if you go to any of the county health departments, now I'm going to say, you're right, Eric, on a national level, you're not going to have that data that you need, but on the local level, you're going to have that data. And that's why I would say drill down to your county health department, whether it's Tarrant County, Dallas County, Collin County, Harris County. You can look up and see, and they'll show you the number of deaths. Right off the top, you may see just in Dallas County, whites around 40%. But when you put African Americans and Hispanics, then they are together, they're above 40%.
And that would be attributed to underlying health conditions, am I correct, Zach?
Well, you talk about, and that's what I think is amazing. You talk about hypertension, diabetes, you talk about any of these issues that African Americans face, but this is not new. I've been in Dallas all my life, and you talk about 75216, 1517, they have used these zip codes to get money into areas or into their various facilities, but there is nothing in an outreach in the southern sector. For example, my concern, not only with the public health part of this, I'm concerned with the mental health. People staying in the house, they're going to have episodes. Their family members are going to have episodes. To your viewers, how many of them know if something happens in their house related to mental health, do they have to drive all the way to the north side to get assistance?
Because we don't have mental health facilities on the south side, do we?
And it may be one. And I always say there's one, but I'm gonna tell you, most people don't know anything about it. I'll give you a quick example. I hate to jump to these points, but I want to make sure we cover them too.
Yes.
The mental health. But in the southern sector, when you go to try to find Lysol, bleach, all of those items, you know what? I had to find all of those items in North Dallas.
Oh my God.
So when you start talking about protection, when you start talking about disparities, I want to make sure I'm clear is that from the public health model of these underlying diseases that everyone has, they already knew that. Nursing homes, high risk. Homeless shelters, high risk. That's all in the pandemic plan. So all I'm saying is, why are we shocked? I think we have to look at this, and I commend Commissioner Price for looking at both sides of this. Do we look at the economic side and the public health side separately. No, we look at it together. But we can't sit here and wait for a vaccine because the vaccine is 18 to 24 months down the road.
And I'm glad you brought that up, that vaccine.
Yeah.
When and if the vaccine becomes available, with the numbers that we're seeing in the African-American community, the hoaxes, the myths, the lies, all of the above, are we going to take that vaccine? Will we trust that vaccine? And what is it going to look like at the end of the day when this really kind of calms itself down and we get a handle on this thing? Or will the African-American community be decimated economically and health-wise?
Well, I'll give you an example. We did the flu clinic. Every year we were doing flu clinics. The majority of the people coming in for the flu vaccine were whites. In terms of African-American and Hispanics, they were slow to come in. Only when we start talking about number of deaths in terms of reporting did you start to see an uptick. But again, I think people are going to be hesitant because they may not trust the vaccine.
Our president also said this week we can take Lysol. So, I mean, if you're hearing that, Zach, and you're hearing that from the leader of the free world telling you can take Lysol and inject it, and then all of a sudden they say we got a vaccine. Well, am I going to believe that vaccine is really going to do its duty and get me well? I mean, because the president just said Lysol would do it.
Well,
So,
I know, and
that does a disservice.
Right. Yeah, we're not trying to audition for Saturday Night Live, so we got to be serious about this in terms of vaccine development and not throw out things that can mislead people. So the vaccine is going to be a challenge. If they're saying 18 to 24 months, you're still talking about the circulation of the virus in that time. So now, are they hoping that everything they call it the herd immunity, meaning that if all of us get the virus, mild cases of it, then we have built up the immunity. That's where I want to make sure it's clear that it's like the common cold. We have it, and then it comes and it goes. It's like the flu virus. We have the virus, we may be down for 2 weeks, we back up. So that may be the thought. Everybody, here's the way they stop everybody. Well, leave it up to the scientists. Well, I want to make sure that we're clear on that when we say leave it up to the scientists. We always want to have a second opinion. And that was my point earlier about going to the doctor. I go to the doctor. I didn't see my main doctor. I saw one of the people that worked for him. They said they thought they saw something. I didn't believe it. I went to my doctor and he agreed with me. There was nothing. It's called second opinion. He's a scientist, the first doctor, but I want to go to a more experienced doctor who's going to look at it. So now they're going to say, we got a vaccine. Will African-Americans take it? The key is, will Americans take it? It's going to be a challenge to convince people to take a vaccine. And especially if you're waiting 2 years to get a vaccine on the street. And that's what I think is the concern is. So 2 years, we're going to be up and down in terms of we may have to shut down again. We may have to shelter in place. This is going to be a challenge unless that herd immunity has been developed where we all have gotten the virus in a mild sense, and we haven't had to go on ventilators, and we're able to function. And I think that's where the debate is going on now, is that we have to open it up. I forget the country, I've been talking a lot, but it's one country that they keeping everybody together. They're doing the herd immunity, and it's called the survival of the fittest almost. So those that survive, so be it. But I want to be clear to your target audience. We're strong as African Americans. They did an experiment called the Middle Passage, where they brought us up here through a boat and put us at the bottom, and we made it. And so we'll make it through this. But I'm going to say, wear your mask. I'm going to make sure he's saying, wear your gloves. We support that, but I've been wearing mine since the first time they started talking about this matter, because they don't know. And let me say this, anytime people are having press conferences every day or every other day, that means no work getting done because the work is on the ground. It's not at a press conference. That's right. And that's where you have to do the education. Nursing homes, right now, you go to that same data, the majority of those cases are out of nursing homes. And then the last piece, the public, you talk about the labs, the private labs are the ones that are generating the testing, because people are going to a private facility and getting tested. And so that's a key point. But going back to your key point, there's not going to be enough testing to deal with everyone in Dallas, Texas, or the United States.
Well, Zach, in closing, this pandemic has really has done a number on people that I've talked to in the community. People are really stressing. People are really afraid. People have lost their jobs. You know, we got single parent mothers out here with 3, 4 kids, no help. You know, what does this look like for Black America and America in a whole at the end of the day? I mean, because we all want to see this come to an end. Well, what does this look like to you as someone who's been in that position, who's had to make those decisions? What does this look like at the end of the day for us, Zach?
Well, I want to make sure that we know that our wealth is our health. We got to protect ourselves mentally, and we got to stay strong. We got to stay prayed up. But I think we're going into a situation that we've never been through before. I hope that people are able to have their jobs once they say all clear or they're allowed to go back to their jobs. But right now, we're talking about, on an economic side, a loss of jobs that we've never seen before. The possibility of people losing their homes, the possibility of school not even opening up in the fall. And so you're talking about people who are juggling a lot in their lives. So I don't want us to get caught up in a tunnel vision where there is no out. There is an out. But that's why I said cut off that TV. If they got press conference, don't keep looking at them on it. They're not talking about anything. You can look at for yourself on how many cases. But protect yourself, protect your family. The hardest thing right now for people who have grandmothers and elders, that they can't even go around them. And just imagine if somebody dies now, they only limit you to 10 people at a funeral. This is having a devastating effect on us, not only from an economic, but from a mental health standpoint. So what does it look like? I'm gonna tell you what I'm gonna do. I'm gonna keep going out, spreading the word. I'm out in South Dallas. I'm doing those things. And I'm gonna encourage those who are sitting at home to do something. Educate your neighbors, touch base with them, check on them, do something positive, write letters to these elected officials. Ask them who is in your who's on your committee to discuss what's going on in our community. Where's a community committee? We got to take, when you are sitting still, that's where the danger is. When you're taking action by getting involved, volunteer down at the food bank, do something other than sit around and listen to somebody tell you to inject Lysol in your system.
Great point. Well, one last question for you, Zach. Should this continue and we go into the second wave in the fall, and the African-American community really can see the disproportionate effect that it's having on it, can you foresee or envision just Black communities being quarantined and other communities being open, because they say that we're more impacted, we're more infected, but north side of Dallas is not having the type of cases, and so we got to quarantine the southern sector of Dallas? Do you see that?
Now, I would hope
I've heard some people say that they fear that.
Yeah.
I don't know if that's something that come to fruition.
I think that would be a hard one, knowing our elected officials that we have in the southern sector. But I think what we have to look at in terms of that second wave is that's why they keep talking about a second wave. We're now we'll be going into the flu season and now the coronavirus. We're going to have 2 active viruses going on. And that's why it's important that the first thing, we got to do our medical checkup. We got to go see our doctors. We have to have a medical home. When people saw everybody around our building for immunization, they were saying, why are they standing around there? They don't have a medical home. And so I'm going back to the point that we have to get the proper information, like what you're doing, Eric. I commend you for getting the message out. We have to have a community dialogue. When Ebola was going on, we had a community dialogue. Of course, we can't get together, but we could all do it by Zoom. we had a community dialogue about Ebola, where it opened it up where people could have discussions. Same way with this particular virus.
Yes.
How we're going to have a discussion and what is our next step? But I'm going to say this, and I want to be very clear. We were not included in the beginning of the discussion, but we were impacted greatly. So I don't see a quarantine. I see that second wave could even be more deadly to African Americans and Hispanics, because what did we learn from the first time? You didn't include us. And so now we get ready to go into the second wave. And I can't imagine in 2020, and I'll be nice about it, in 2020 that you don't have, we were inclusive. We kept people involved through it's difference of opinion. And so therefore you were able to break down the barriers when you ran across issues in your community. But I'll say throughout the nation, when you see the president, when you see the state, when you see local, do you see any African Americans and Hispanics?
No.
I rest my case.
Well, Zach, I certainly appreciate you sharing this wealth of information and knowledge with the constituents of the Southern sector in America. And I certainly hope that I can have you back on. I've enjoyed this conversation today. We're going to get this information out to the public. And you have been a great guest, and I thank you so much. And thank you for allowing me to share this moment with you today.
Thank you. Your health is your wealth.
Thank you so much. Bye.
By April, in theory, when it gets a little warmer, it miraculously goes away.
The coronavirus, which is, very well under control in our country. We have very few people with it.